Hello, I'm Sister Tandy. Today we are talking about something that affects almost every working South African, but that almost no one talks about at work. We are talking about financial stress, the worry about money, the fear of debt, the exhaustion of trying to make ends meet every single month. This is one of the greatest contributors to poor mental and physical health in our country, and it is one of the least discussed. Today, we change that. Let's start. Financial stress is not simply about money. It is about uncertainty, about the feeling that you are one emergency away from losing everything. It is about lying awake at 3 in the morning, calculating whether the month will last. Research by the South African Savings Institute found that the majority of South African workers spend more than they earn each month. Consumer debt in South Africa is among the highest in emerging markets as a proportion of disposable income. Millions of people arrive at work every day carrying a financial burden they cannot discuss with their colleagues and cannot put down. This is the invisible epidemic. Financial stress is a medical condition. I say this not to alarm you, but to validate what your body already knows. When money is a constant worry, cortisol stays elevated, and we have already discussed what that does to blood pressure, glucose, and cholesterol. Financial stress is one of the leading causes of insomnia in South Africa. It drives relationship conflict. Research consistently shows that financial disagreement is the most common cause of relationship breakdown. It contributes to depression and anxiety. It increases the likelihood of substance use as a coping mechanism. When your medical examination flags elevated blood pressure or disrupted sleep, financial stress may well be the cause that no blood test will ever show. The debt cycle is not a personal failing. It is a structural trap. Here is how it works. An unexpected expense, a medical bill, a school fee, a broken phone, pushes the month into deficit. To cover it, a short-term loan or credit is used. The loan comes with high interest. Next month, more of the salary will go toward repaying the loan, leaving less for essentials. Another deficit, another loan. The hole gets deeper with each cycle. Many people carry multiple loans simultaneously. This is not bad financial management. It is the result of living in a system designed for people with savings buffers when most working South Africans have none. Before we talk about practical steps, we need to address the shame. In South African communities, across many cultures, financial struggle is carried in silence. There is deep pressure to appear okay, to provide, not to burden others. This silence is costing lives. Your financial situation does not define your character. You are not bad with money. You are a person navigating a genuinely difficult economic environment, one of high unemployment, rising costs, stagnant wages, and family obligations that extend far beyond a nuclear household. Shame thrives in silence. Acknowledgement is the first act of change. Here is your first practical step. Track your spending for 1 month. You do not need a spreadsheet. A notebook works. Your phone's notes app works. Every time money leaves your account, whether as a debit order, an ATM withdrawal, or a till slip, write it down. At the end of the month, group the expenses: housing, food, transport, debt repayments, airtime, and everything else. Most people who do this for the first time discover 2 things. First, they spend more on small items than they realize. Second, they feel less helpless than before because now they can see the picture. You cannot change what you cannot see. The 50-30-20 budget rule says 50% of income for needs, 30% for wants, and 20% for savings. In South Africa, where many workers support extended families and face high transport and food costs, this needs to be adapted. A more realistic starting framework for blue-collar workers might be 60% for essential needs, including family support, 30% for debt reduction, and 10%, even 50 Rand a week, for emergency savings. The goal is not perfection. The goal is intention. Having a deliberate plan, however imperfect, puts you in control rather than letting the month dictate your response. Intention is the beginning of freedom. The debt snowball method is simple and it works. List all your debts from smallest to largest. Pay the minimum required on every debt except the smallest one. Put every extra Rand towards paying off that smallest debt first. When it is gone, apply what you were paying on it to the next smallest debt. The momentum builds. Research by behavioral economists shows that completing small goals triggers a psychological reward, making the next goal more achievable. You are not trying to eliminate all debt at once. You are building a habit of winning. One small debt eliminated is a victory. Celebrate it. You earned it. You do not have to navigate this alone. In South Africa, several free resources are available to people under financial pressure. FAMSA, the Family and Marriage Society of South Africa, offers confidential financial counseling alongside relationship support. You can visit www.famsa.org.za or contact your nearest branch. The National Credit Regulator provides free referrals to registered debt counselors who are legally required to act in your interest, not the lender's. Your employer's Employee Assistance Program, if available, may also include financial wellness support. These services exist because financial stress is a health issue. You deserve access to support. Please use it. Before you go, here is something worth knowing. Research by the American Psychological Association found that people who write a monthly budget, even an imperfect one, report significantly lower anxiety levels than those who do not, regardless of their income level. The act of planning itself reduces the stress of uncertainty. You do not have to be debt-free to feel better. You have to begin. From all of us at CareNet Consultants, your best is good enough for today. See you in our final video. CareNet Consultants, your partner in workplace health.